So what would be the next steps, Dr. Ailawadhi, for a patient who's had CAR T and reaches a relapse state or is relapsed?
Yep. This is something, unfortunately, is the truth of the matter in myeloma, at least, that we don't see cures. We have had some long remissions. I have, for example, patients who are now reaching 3.5 years of remission on CAR T treatment, who received it on clinical trials even before they got FDA approved. But unfortunately, the disease does come back. So what happens is we are seeing data that the other novel immunotherapies like bispecific antibodies, even the ones who go after the same target as CAR T, BCMA targeting bispecifics, they do have some response rates, good response rates in post-CAR T setting. So the bispecific antibodies by themselves may give a 60 to 65% response, but in the post-CAR T setting, that response might go down to 40, 45%, so less responses, but still possible. There are also bispecific antibody. There is one available, which is not against BCMA, it is against GPRC5D. That's a bispecific called talquetamab, so a novel target. There are, of course, a lot of clinical trials. There are some clinical trials that are even looking at CAR T, post-CAR T, so a different kind of a CAR T. Those clinical trials are going out. So what I would suggest is that if your disease progresses after CAR T cell treatment, you should very strongly consider getting to a specialist myeloma center and get an opinion, like you mentioned, Lisa. That is so important because the choice of treatment is extremely important at that time. And we are trying our best to sequence all the options we have. In a way, actually, one of my patients mentioned one of these days, hey, does that mean that I'm basically buying time till something new and exciting comes along? And I said, in a way, that is true, that we are trying to stretch all our treatments and get to the point that something new and promising, just like CAR T, comes, and hopefully we get longer benefits again.
Thank you for that. So when you say there's a possibility of CAR T and then a post-CAR T, maybe a second CAR T, would that be a different target then?
So there could be a different target. I have, in fact, I saw a patient who had received one CAR T in a clinical trial, and then they were subsequently able to receive a CAR T as standard of care, which had been FDA approved. So they used different CAR Ts, but one was in clinical trial and one was a standard of care.